This week's program was filmed at Medical City, Dallas. Founded in 1974, Medical City is recognized for its state-of-the-art medical facilities and commitment to excellence in patient care. Located in Dallas, Texas, the hospital's medical team consists of more than 1,150 physicians, many of whom are recognized as the world's best in their specialties. Medical City, specialists in life. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Welcome back, everybody, to Platforms, the life-lifting news program for women. We're finishing up our conversation this afternoon with Dr. Joseph Kuhn. He's one of the top bariatric surgeons in the state of Texas. This has been a fascinating show today. Dr. Kuhn, I wanted to talk to you about a very interesting event that you're chairing this year. It's a national event. It's called Walk From Obesity. Tell us about that.
Well, it's the Dallas-Fort Worth effort. This is conducted all across the country in major cities. And it's designed not just to promote bariatric surgery, but it's to get the message out to the population about obesity. When you think right now that most health plans don't cover bariatric medicine, you can't go to your doctor in most cases and say, listen, I would like you to help me lose weight. The effort that this walk promotes is not just obesity awareness and the effect on disease, but obesity prevention in our schools and among our youth.
Huge issue.
So to me, it's a community obligation that we have as the facility at the institution, as us as doctors. We try to get all the doctors in the city involved, get all of our former patients, but we'd like to get weight loss centers, we'd like to get schools involved. I mean, this is every bit as important as a walk to prevent heart disease.
Absolutely, absolutely. You know, looking through your extensive CV before I met you, I know you've won numerous outstanding teaching awards. It says a lot about your love of medicine, how you approach things. What are you seeing with these young residents and interns that are coming into this field in terms of their thoughts about patient care, compassionate care, and approach to overall?
I am seeing an opening of their sensitivity towards bariatrics and obesity. And whereas it used to be 10 years ago, a bariatric surgeon was a lower tier surgeon, maybe somebody who was a rarity and was sometimes looked down upon.
When you say lower tier, what do you mean by that?
Well, sometimes somebody who...
Not like a rock star, like a...
Not like a rock star,
okay.
The opposite. But,
okay.
But in reality, now some of your better, brighter, more energetic and enthusiastic residents are going out and keen and eager to embrace this surgical treatment for not just a physical obesity syndrome, but all the medical problems that we have an opportunity to cure, turn around, and wipe away.
Right. You know, as a conventionally trained doctor, I know that you hear the term body, mind, and spirit, but many people are feeling now that more and more doctors are really realizing the importance of connecting with patients and treating the entire person, not just the disease, I guess.
And this operation and just the interaction gives you a chance to do that. You see them before, you're their coach through, and you help to transform them, really.
Talk about the importance of the family being educated, because this is a life-altering procedure. So if the spouse or the kids aren't on board, or family members to kind of support the person making this drastic lifestyle change.
It is essential, because it's not just, gee, I want you to have this procedure. It's, we're going to be involved with the food. We're not going to allow bad snacks to come in the house. We're going to support you emotionally, but we're going to look what you're doing. A lot of times we see a benefit from children and spouses who adapt and change their eating behavior.
There's a residual effect. They
lose
lose
weight.
Yeah.
Exactly.
Yeah. Another point, and we'll go back to this because I think it's so key, is educating or putting healthy foods in our schools and even in our corporate environments. It's so ironic sometimes when you go to a facility and there'll be like a fast food restaurant there as part of the, to offer the general public. So it really boils down to corporate responsibility and our educational system.
I couldn't agree more.
Right.
That's perfectly stated.
Well, thank you. Well, Dr. Kuhn, it's been an absolute honor having you on this show. And for more information on what you're doing here with WLS, tell our audience what the practice, what that stands for, and best way to get a hold of you and get more information.
Well, WLS is weight loss surgery.
There
and
you go.
so we are WLSdocs.com. And so that's a good way to reach us. But also through Medical City, they also have a great way to get a hold of us.
And just in closing, any professional or personal mentors in your life? You obviously love what you do, medicine. Was there anybody in particular that encouraged you to go into this field and somebody who's made an impact on you professionally?
Well, I've had a lot of mentors, and it would be hard to name them all, but the one that specifically addressed this field, got his start here, Larry Barzoon, who's really probably in the country one of the fathers of bariatric surgery.
Wow.
He was doing it in the old open era, but by the same token, he paved the way for surgeons like myself when laparoscopic tools and equipment have made it so simple and easy. But he's one of the colleagues that provided that 25-year experience, and so I would say he's a mentor.
That's wonderful. Well, Dr. Kuhn, it's been an absolute pleasure having you on the show. We'll have to have you back. Very important topic.
Thank you.
Ladies and gentlemen, that concludes our show for this week. I'm Siobhan Palmer with Platforms, the life-lifting news program for women. Take care, and we'll see you next week.